Hi, my name is Ying, and this video is for my 40 checkoff on female patient. Before I start, I'm gonna check the healthcare provider order. The patient's name is Anna Pawlowski. She's allergic to penicillin, and the reaction to penicillin is HAPS. And the patient does have an order of the urinary catheter insertion, involving catheter insertion. And I'm gonna knock the door. And hi, my name is Ying. I am your student nurse today. And I'm gonna put on my hand hygiene. Today I am going to do an indwelling urinary catheter insertion on you, and then this is for the urinary retention. Before I start, can I have your name and date of birth, please? I am prepared all the information patient says and compare it with the chart, and as well as check on the patient's armpit. And also I'm gonna ask patient, do you have any allergic? If you have, what's the reaction? I'm gonna check on the patient's armpit and also check on my computer. And after that, I am gonna to close the curtain to provide the privacy to the patient. I am gonna also ask the patient, do you have any ureter restriction? And also gonna ask the patient, have you ever had any history of the difficulty of the insertion of the urinary catheter? And if the patient has any, I would stop the procedure and call the healthcare provider immediately. And after that, I am going to do my hand hygiene and apply the clean gloves. So I have my clean gloves here, and I have all my supplies right here as well. Here's the tape. After I put on my glove, I am gonna raise the bag to the working position. And also I'm gonna lower the set drills on my set. Okay, I'm gonna lower the set drill, and I am going to put the patient in a dorsal recurvent position. I'm gonna bend patient's knee and to open patient leg. And I am also gonna ask the patients to relax on the set so I can do my procedure. And I'm gonna also to expose the patient perineal area by folding the linings, and then make sure the patient other part is covering. It's better protect the patient's privacy and provide the safety to the patient. So I am going to use the hospital approved cleaner to clean the patient's perineum area and to identify the midis and to check on the midis as well. And after this procedure, I'm gonna remove my gloves. and then do my hand hedging. Okay. This is my cake. I am gonna open it, and for the plastic bag, I'm gonna use this one as my trash can. And put it on the side. And then I'm gonna start to open this one between the patient's leg. And I am gonna also ask the patient to maintain the sterile field. I'm gonna open the drip by only touch the border of the drip with the shanny set down. And I'm gonna apply. I'm gonna do my hand hedging again. Here. And then put my sterile gloves on. Then I will do the other side. And after that, I'm gonna use the plastic drip and put it in between patient's leg. And make sure like the patient's meatus is exposed to the hole. And then I'm gonna organize the stuff in my kit. So I am going to remove the plastic cover on the urinary tubing like carefully and slowly, and make sure it is clamped, and put it on my sterile field. I am also gonna use my syringe, 10 ml syringe, and attach it to the the green portal, which is a blue insertion set, blue and blue insertion set. And I'm gonna use the hydrogen peroxide and pour it on the cotton balls. Open it and pour it on the cotton balls. And after that, I'm gonna open the lubricating jelly and put it on the tray. I'm gonna put my insertion set of the urinary catheter into the tray which have the jelly inside, and to lubricating it. And then make sure it's sterile. And after that, I will to clean the patient's the perineum area, the midis, and I'm gonna clean from top to the bottom, and from farthest end, and through the way, and then nearest the end, and through the way again, and then I'm gonna clean like from down to the middle. Okay. After that, I'm going to start the insertion. I'm gonna hold like a 3 inches from the top, and tell the patient to bear like a little bit when the insertion of the catheter, and I'm gonna insert very gently and slowly. And as a little bit the urine come out, I am gonna insert like another 1 inches after I see the urine. I'm gonna to inject the liquid from my syringe to the balloon to inflate the balloon with 10 ml sterile water, like very slowly. And after that, I am gonna disattach with the syringe with the injection portal, and I'm gonna pull away the urinary catheter until I feel the resistance. I am gonna secure the tubing on the patient's thigh. Just above the branch of the tubing to the patient's inner thigh. And I am also gonna secure the bag on the side of the bag, and the coil the extra tubing, excess tubing. Okay, and after that, I am going to remove my sterile gloves. I'm gonna also check the patient's safety, and make sure the bed is at the lowest position. As patients, you feel comfortable? Is everything okay for you? I am also gonna provide the hedging as needed, the perineal hedging as needed, and I'm gonna make sure the tubing is not obstructed. I am going to perform a hand hedging after I remove my gloves. So I am gonna document that I'm done with the insertion of the urinary catheter. I am gonna also document the amount of the urine obtained, the color of the urine, the clarity of the urine, the size of the catheter, and also the amount of water place it in the balloon, which is a 10 milliliter, and I'm going to remove all my supplies, like all the waste. So just throw everything away. And I'm gonna remove the penetrating drip as well. Like I tear it. So. And I am gonna open the curtain for the patient, and I'm gonna lower the bed. Make sure the bed is at its lowest position, and the side rail is up, and there is no cluster on the ground, and the brake is locked. And I think that's it. And I'm gonna perform my hand hygiene before I leave.